more than 2 million deaths per year between 1992 up to 2000. And this is the scheme of AWD. And my objective is to describe the epidemiological and clinical picture of the outbreak, to make to make a recommendation in order to prevent the future outbreaks. Methodology: a study setting a descriptive study was carried out in Parwan province from July 10 to August 24. Outbreaks setting Parwan province. Data source: active cases finding were initiated through outputting OPD search supported by the establishment of a standardized case definition. And date of data outbreak data collection July 10 to August 24. Analysis by EPinfo, Excel, and DH2. Result: as we go to the result of this eye chart, and we see AWD outbreak is in under 5, as we have 3%, and over 5 we have 97%. And AWD by gender, we have 51% in female, less than we have male in 49%. And the age category, we have more than cases between 10 years old up to 39 years old. And we have just 2 cases between 90 up to over age. And this is the EP curve. We have 2 peaks between 20 July and 4th August. 2 peaks. In the first peak, we have 16 cases, and the 4th August, we have 50 cases. And distribution of AWD cases, we have more cases in Charakar district, after that Jabal Saraj, after that in Bagram. And we didn't have any case in Surkh Parsa and Sheikh Ali districts. RDT for AWD, we have just 70% positive cases, and we have 57% clinical cases, and we have 26% negative cases by RDT testing. And this is the spot map of AWD. In Parwan province, we can see more cases in center of Parwan province, in Charakar and Jabal Saraj district. And this is a sign and symptom of AWD cases. And some cases have complication. They have dehydration, malnutrition, and shock. And just we have 11 cases has renal failure. AWD cases by okay, no problem. AWD cases, some cases use open infection, and some cases use unimproved toilet. We see 74% use unimproved toilet. And discussion: AWD cases mapped along the water lake of the mentioned district, and the lake server has the primary source of drinking water to the population who live it in there. And also in the present study, female suffered more as male. And conclusion: the outbreak in Charakar district under court commitment water and safe storage has major risk. And the most effective measure to prevent transmission of acute watery diarrhea or prevention of safe urinary. And cleaning other person after toileting or before preparing, serving, or eating food. And this is the recommendation based to the finding of the investigation by considering the following prevention measures. It might be helpful to prevent the occurring of such outbreak in future. Provide a specific place for infectious patient in provincial hospital. Consideration sanitation and OPD availability of health workers during their shift. Provide essential drugs in OPD by implementer NGOs. And this is the reference. Thank you. If you have any question, at the end I will be answered. Thank you.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Thank you very much, and in the name of Allah I will start my presentation, but if it comes on the screen then. This is the title of my study is Evaluating Oral Miltefosine Drug and Sodium Stibogluconate for the Treatment of Cutaneous Leishmaniasis in Kandahar, Afghanistan. This was a double-blind, randomized controlled trial which we conducted there. So this is just, the paper is not published yet, but this is the manuscript we have worked on. And I'm very fortunate that I have had a very, expert colleagues from around the world. That from Afghanistan we had the colleagues, from Thailand and from Switzerland, Geneva University Hospital, and from University of Oxford, from the Netherlands, from Sweden, and from Colombia. So this is a very good thing for Afghanistan in a way. This is the outline. And in introduction, cutaneous leishmaniasis, you know better that it's a sandfly transmitted disease, and it is counted as a disease of war and poverty, and neglected tropical disease also. So this is caused mostly by the Leishmania. So Leishmania major, Tropica, and Ethiopica. These are the countries where mostly these are the Leishmanias, and mostly it is extended from West Africa to the Western China, because we are talking about old world cutaneous leishmaniasis. The new world cutaneous leishmaniasis is mostly in Americas, Central and South America. And each year around 600,000 to 1 million new cases of cutaneous leishmaniasis are reported worldwide, and about, unfortunately, 85% of these cases are reported from just these 9 countries. Most of them are in EMRO region of WHO, so Afghanistan, Algeria, Brazil, Colombia, Iran, Iraq, Pakistan, Peru, and Syria. So, So in Afghanistan, usually based on the studies, Leishmania tropica and Leishmania major. These are the major strains here in Afghanistan. And Leishmania tropica, mostly it causes anthropogenic disease. It means caused by human beings, got from that. And it's mostly seen in urban areas, just like in Kabul city, Kandahar, and Herat. And Leishmania major, which the main vector is Phlebotomus papatesi, this causes a zoonotic disease. And it's mostly, the cases that have been reported is mostly from Balkh province. Balkh province, it's reported from there. So as a whole, in Afghanistan, we only have sodium stibogluconate and meglumine 2-miniate. These are the 2 drugs which we use here in Afghanistan. But unfortunately, the main thing is this: at first, these are injectable drugs. They do not have any oral drug. And the other thing is this, that they have very severe side effect, like in the case of anaphylaxis, fatal cardiac arrhythmia, increased hepatotoxicity, and it can cause pancreatitis and bone marrow toxicity. On the other hand, miltefosine is a drug which is oral drug, which comes in the shape of capsule and the tablet. Mostly it's the case shape of capsules. But unfortunately, it's not used in Afghanistan. Just in 2 or 3 studies, those are just among the soldiers, Canadian and Dutch soldiers, they had used it. Otherwise, it's not used here in Afghanistan. The main objectives, so the primary objectives were in the shape of research questions, just like what's the cure rate of miltefosine treated cutaneous leishmaniasis at 6 months, because we followed up the patient for 6 months, each patient. And is the cure rate of oral miltefosine sufficiently high to be a potential replacement for sodium stibogluconate? And the secondary is what's the relationship between miltefosine pharmacokinetic and the Leishmania parasite load, and also the measure lesional size assessed by, usually we used Entera camera, a 3D photographs instead of using the normal photographs.
You have 1 minute.
Oh, that's right, sorry. I mean, in methodology, I said that this is an open label, single standard, parallel label, double blind study, and it was conducted in Kandahar, and it was between 2019 December and 2021. So it was the COVID-19 era. And it was the clinical trial registration, funding, and ethics is here mentioned. So the inclusion criteria was blood stained, blood GIMSA stained, aims to go to positive patients were there. And in exclusion, we had just the adult females were not there due to the side effects of meltifosine. And we did the randomization and masking. And in methodology, we used the 3 arms. One was meltifosine, oral, the other one was intramuscular sodium stibogluconate, and the third one intralesional sodium stibogluconate. So this was just the dose for these 2 drugs. This was the study schedule that we had. In the results we had, among 1,047 patients, we enrolled 103 patients. We enrolled there. And just I will go a little bit quickly. These are just our 2 patients, right? So in the results, I will just go to the so yeah, baseline characters. Most of our study participants, they were children. Most of them were there because mostly we see this disease in children. And the male-female ratio was 61 to 138. And we had G6PD normal and as well as deficient patients. We also had it. And this was cumulative cure rate. I will let you know later in that. These were just the patients' laboratory that we were looking for: AST, ALT, creatinine, and total bilirubin. And this was just the changes in laboratory. So most of the changes that we had it means that in a way that which were hepatotoxicity and also creating increased creatinine. This was mostly seen in intramuscular sodium stibogluconate patients, right? So this was just this is the Kaplan-Meier plot that we did it. So mostly the efficacy of intramuscular was more, and then intralesional sodium stibogluconate, and then at the end there was meltifosine oral.
Thank you very much.
Yeah. Yeah. So this is the conclusion of it. Is it enough, or I should say something more?
It's okay. Thank you.
Thank you very much. That's right.
Thank you very much, Mr.
I thank you for nice introducing me. The topic which I want to present is changing dynamic blood stress